first ketamine infusion, and just waiting for Dylan to come so he can drive me, as you can't drive yourself back afterwards, obviously. So I'm having it done for my PTSD, and I'm hopeful that maybe some of the anxiety and depression symptoms will go away as well, but that's not my main motive for using this type of therapy. I know it's something that's new and a lot of people don't know about, and it feels like there's a lot of stigma around it. People think that it's like a party drug, or maybe even relating it to medical marijuana. And from what I've read and the research I've done, it's very different than that. It's more about rewiring some of the neural pathways in your brain to give you the opportunity to kind of process through some of the traumatic memories, or get you to a place where you can do that in therapy. And I feel like I've been kind of at a standstill in therapy for like a year. I've tried to do EMDR, and the physical, like the somatic results afterwards were just too much for me to be able to go and continue doing it. It was just very, very, very scary for me. I just had a lot of like physical reactions to it and feel just very scared and kind of out of body experience. And I didn't want to continue doing it because I was so apprehensive about feeling that way afterwards, which kind of left me in this holding pattern of trying to talk about the process of the trauma in therapy with talk therapy, and then regressing in eating disorder behaviors because I would feel triggered. And it was like over and over and over, and it was really frustrating. So I was excited to learn that there was a facility in my area opening up that was offering the ketamine treatment, so I didn't have to travel to do it. And our insurance is paying for part of it, which I'm thrilled about. But I'm hopeful that I'll make some progress and it will be worth it.
So that way we can take sort of a measurement of like what you're feeling now versus what you're feeling after.
Yeah.
So you're not hurting?
No.
Well, in order to get started, you need IV access.
Sure.
All right, you already took your, it's okay?
Yes.
I'm gonna do your EKG dates. I'm just gonna get 1, 2, and 1 up on your right. This one goes like right there. There you go.
Okay.
And, all right, well, ready to get started?
I'm gonna put a pillow behind your back. And I'm gonna tilt you all the way back. Oh, sorry. Sorry, I didn't mean to do that. Do you wanna go back a little more?
No, that's good.
Okay. And then, do you wanna do, you wanna use Alexa for music?
No.
Okay.
I'll make him talk to me.
Okay. You guys can certainly put on, then that little orange button is a call light if you need it.
It's just what you need. So you start at like a slower rate and then you increase it
No.
based on how you do it?
No.
Or no?
We start you at a particular dose the first time just to get you used to it,
Okay.
and it's fairly low.
Okay.
And so, but if at any time you feel like it's too much, it's really easy to either cut back or turn off.
Okay.
All right, you're off and running.
That's it. Yeah.
That's good?
Yep.
That's it.
That's
man.
it.
It's
It's as easy as that. Yeah, so call us if you need us. We're watching you the whole time by video. We can
Confident.
see your vital signs all the time. All right.
Cool.
Let us know if you need anything.
Thanks. Alright, on a scale of 0 to deadly, how scared are you?
I'm definitely a deadly.
Okay.
Like a 10. Yeah, my anxiety is definitely at a 10.
Ooh. Okay.
A little freaked out.
That's alright. Now how long is this? If you can just takes like 5 minutes?
No, 5 minutes. Stop it if we need to.
Oh.
It takes like 45 to an hour.
Okay.
So stupidly nervous.
It's not stupid. You don't know what to expect.
Overly dramatic because I don't have any control over it or really like know what to expect because
Yeah.
it's the first time.
Yeah. Seems pretty normal to me.
I guess. No, I feel like I should not be nervous about it because I know so much about it, what it does, and have seen other people go through it, but it's so individualized
Mm-hmm.
on how everybody handles it.
Mm-hmm.
I don't exactly know what to expect on my own.
That's okay.
My face feels kind of numb. I don't know how to describe that
Mm-hmm.
other than the words I used.
Seems reasonable.
Really kind of floaty.
Okay.
Vision feels a little like fuzzy. Oh, now I feel floaty.
Mm.
Like up out of the chair.
Nice.
Alright, tell me something funny. Go. Oh no, wait, I have something funny to tell you.
Okay.
Okay, so this morning, after we took the little kids to the bus, Griffin comes back and he puts on his really tall dress socks from like Christmas,
Mm-hmm.
the Argyle ones,
Yeah.
and then he puts on his brown leather Oxfords from Easter,
Right.
and that's what he decides to wear with his emoji shirt and his jean shorts.
Perfect.
And he came up to me and he was like, we're gonna hashtag this Casual Tuesday.
But it's not like being buzzed, like alcohol buzz.
It is, but it's like, I don't know, like I've never done any drugs, so I don't know. Which I guess is good.
Yeah. No complaints here.
Whoa.
Wave.
Yeah.
Good time to ask you a bunch of serious questions and then hold you to those answers.
Definitely, like truth serum?
Yeah.
Ask away, what
You said.
what do you need to know? What have you been dying to ask me? Lots of spinning. Is it done?
Yeah, that's a whole hour.
Whoa, that went by really fast.
I see some movement. You feeling like you're coming back?
Yeah.
Okay. Let's take this and I'll sit you up. Okie doke. So let's get this out. And then that's your EKG leads and that will be it.
Okay.
So he's coming back for you.
Okay.
So you had to go, your husband?
Yes.
You had to go way out and then he's coming back again?
Yep.
Oh man, he's gonna be, you might have to wait a little bit.
That's fine.
They said it helps them really focus. They don't have so many distractions that they usually are battling. So I'm interested to see if you haven't seen.
Me too.
You're comfortable.
Yeah. Oh, I like
Okay.
it. Been home for a few hours from the infusion and I still feel kind of goofy, but it's way less than it was right after the infusion. Overall, it was a really good experience. It was pleasurable, I guess. I felt relaxed. And I know I wasn't at like a therapeutic dose. They build you up to that. So it wasn't like the experience I'll have probably next time or the time after that when they increase the milligrams of the ketamine. But it was a good starter. I'm not scared of the next ones. I know kind of what to expect, even though I know that'll be a little bit more of an intense experience next time. I know what to expect. I feel okay with it. I'm ready for the process. I'm ready to not feel so controlled by the memories and all the triggers in my life that go along with those, and hoping that there are some other benefits, maybe some pain relief from my fibromyalgia and maybe some anxiety and depression relief. I would be thrilled if any of those came along. So I'll post another update probably when I'm done with the whole series and kind of give an overview of how it went and be able to explain it a little bit more and how it affected me. So make sure you watch out for that and have a good week.